Okay, my name is Christian Turbide. My dad is from Quebec. My mom is French-Acadian from Nova Scotia. I was born in Moncton, so I grew up as Christian Turbide. Now I live in Alberta, so it's Christian Turbide. I have prescribed medical cannabis to 2,000 patients. In my GI practice, I probably have, I'm going to say, maybe 30 patients of my own. The 2,000 patients is associated with the medical cannabis clinic. So I'm just going to stick back here so you guys can see the screen here. You're supposed to fixate on me and then read the screen to the left, right? So if I go here, well, it's not that. I'm breaking the presentation rules here. Okay, disclosures. I'm a medical advisor for a company called True North Agriculture, and what we do is we encourage Alberta farmers to switch some of their crops to hemp, and then from the hemp we extract CBD oil, and then we sell that CBD oil to licensed producers. The company's 3 years old now. I've also been a speaker for Spectrum Therapeutics as well. So those are my disclosures. So today we're going to talk about the endocannabinoid system. The endocannabinoid system was developed in the late 80s. And the way that they found it was they were studying the cannabis and seeing what were the cannabis effects on the body. And that's why they called it the endocannabinoid system. Cannabis does have an effect, as you know. You just ask a 22-year-old surfer dude. Well, cannabis does have an effect on several things: your mood, your sleep, your pain perception. So the endocannabinoid system, as we're going to see, is a parallel system that is within you already. You have cannabinoids compounds in you that are changing how you think, changing your mood, your sleep, and whatnot. And this system, the endocannabinoid system that is within you, is working with you. Like, should I get up and should I go pee? Should I listen to this guy? Or, it's changing how you think and your mood. And you can take plant compounds, cannabinoids, from a plant, such as the cannabis sativa plant, marijuana plant, or the hemp plant. So these cannabinoids can go in your system and influence your mood, your sleep, your pain, and whatnot. So we're taking plant compounds to go into your own system, okay? So the outline of our talk today is we're going to overview the endocannabinoid system. We're going to talk very quickly on receptor distribution and physiological roles. We're going to talk about medical cannabis safety, very quickly on dependence, overdose potential. We're going to talk about medical cannabis efficacy. So where does it work? Where should we take it? Which patients should be looking for the medical cannabis prescription? Chronic pain, the opioid sparing potential, and maybe some GI effects. And then if there are any questions on dosing and administration. So the endocannabinoid system that is within you already influences a lot of things. Mostly the brain and the central nervous system, and also the immune system in the periphery. So the brain, the lungs, the liver, the bones, the muscles, the vascular system, the spleen, which is part of the immune system, the pancreas, digestive system, the colon, reproductive organs. Apparently, you have better sex if you're high, but that's a study that I read recently, so that it would influence the reproductive system and then the immune system. So the endocannabinoid system influences, there's no pointer. So the way that, like we have electricity in our brain, and then this electricity then brings on a biochemical reaction, and the chemical messenger between two neurons is called a neurotransmitter, which has these red dots between the gap here. So then the neurotransmitter, which is dopamine, serotonin, like what I'm forgetting some, but melatonin, these types of things. These are brain chemistry, neurotransmitters that we have in us that influences how you think, your drive and whatnot. So a teenager that just wants to watch TV all day has no drive. Guess what? Low dopamine. What dramatically increases dopamine? Cocaine. You want someone extremely productive? Give them cocaine. So brain chemistry influences how you think. You have these blood chemistries in you that are influencing your reactions, and then the cannabinoids then influence these chemistries. So the cannabinoids will then influence the dopamine. The cannabinoids, the THC in marijuana, will then influence the serotonin. So that's why you sleep better. That's why you think differently. So the brain chemistry, the neurotransmitters are influenced by these plant cannabinoids compounds. So then these are just the steps of the endocannabinoids. So synthesis 1, as you see, number 1 down there. After the dopamine goes through, then there's the release from the post-receptor, the lower receptor molecule then stimulates the endocannabinoids, and then they go back and influence whether if there's more neurotransmitter or less that are produced. So in the endocannabinoid system, there's 2 cannabinoid receptors. Top left, that's cannabinoid receptor 1, and this is an example of cannabinoid receptor 2. So cannabinoid receptor 1, cannabinoid receptor 2 in your body influences different things. CB1 is more predominant in the brain and the central nervous system. CB2 is a little bit more predominant in the periphery, which influences your immune system. So we have cannabinoids in us already. In the plant cannabinoids, there's several cannabinoids, over 100 as you can see. THC is the most famous one, is the one we know the most. CBD, cannabidiol, CBD is another one. Is that too boring for you, dear? Or? Oh, okay. You didn't have to say that, that's okay. Okay, so cannabinoids, there's over 100 of them. So the plant has several cannabinoids. THC is the most famous one, of course, but there's other ones too. You see CBDA, CBNA. So there's potential for research in the future. Maybe CBG helps sleep more than THC. So this is a very exciting time for cannabinoid research. And because it's been illegal for so long, there hasn't been a whole lot of research, but now that it's coming to the forefront, we're going to be able to research it better. Also, with the cannabinoids in the plant, there's other compounds that are called terpenes. These are plant compounds. That's the lemon smell. That's the pine smell. So maybe a bit more pine influences the cannabinoids to make you sleep better. Or maybe the lemon terpenes make you enjoy that Fleetwood Mac concert more, So the plant compounds influences the cannabinoids. So the terpenes are also important, okay? Those are the plant compounds. What is the plant contributing to the cannabinoids? Other compounds, there's sugar, alkaloids, phenols, things that only a chemist would understand. So those are also within the plant, but just remember that there's many cannabinoids. The most famous is THC. CBD is next, also plant terpenes, which can influence the compounds or not. And that's the difference between most likely buying your product on the street under a bridge downtown, which likely has very high THC, no balance with CBD, and terpenes, who really knows, okay? Well, these licensed producers that are vetted and are producing a consistent product know the terpenes that they have and also influence the terpenes for what you're trying to get. So if you want a compound that can help you sleep, they have the correct terpenes in the compound. And that's why medical cannabis through a licensed producer is more consistent to have the same result just like a drug. THC is a partial agonist of CB1 and CB2, which means that it enters and it influences the receptor of CB1 and CB2. Those are the 2 receptors of the cannabinoid system. It gives you a euphoric effect. It's a mixture of stimulant and depressant effects. Analgesics Anti-nausea, it stimulates appetite, especially in HIV patients, patients who are very sick, don't have any appetite, have cancer, so it can stimulate appetite. It can also have some muscle relaxant properties. Elevate mood, relaxation, increased appetite, but it can also have some side effects. Paranoia, I specifically remember 22 years old, a trip to Amsterdam. I was particularly paranoid, so that was not a great side effect for me. Depression, anxiety, there is a mild side effect on cardiovascular system. There can be some flushing, there can be some heart rate issues. CBD, which is cannabidiol. Cannabidiol is a bit of a brake on the system. It's a reducer of the THC side effects. It doesn't actually work the same way that THC does. It changes how the receptor works, so it doesn't actually like fit in the pocket like a baseball does in a glove. It changes how you catch the ball, okay? It changes the shape of the hand when you're catching the baseball. I just thought of that analogy right now, but anyway. Works pretty good. Negative allosteric modulator, these are chemistry words of CB1 receptor, and it stimulates other things such as a TPRV1. TPRV1 is stimulated by spices, capsaicin cream, and things like that. No euphoric effect, so if you take CBD before going to a Fleetwood Mac concert, it won't change how you perceive the concert. So I like Fleetwood Mac a lot, so I'm going to refer to that. So, and CBD also opposes THC. So if you buy your if you buy your cannabis under a bridge downtown, it will likely be pure THC, pure sativa plant, which is what kids in the street want. If you're trying to do that for a medical purpose, you will most likely get the euphoric effect with the side effects because there's no CBD to balance it out. That's where the CBD is important, to balance out the THC side effects. Okay? CBD does have anxiolytic, neuroprotective. I have a young girl, 2 years old, at the Children's Hospital. She kept on having seizures and seizures and seizures. The neurologist contacted me. I gave her a lot of pure CBD. She was out of the neurointensive ICU after 3 days of being on CBD. Very high dose, but it did get to break her epileptic seizures. It also has analgesic effects, antiemetic, and anti-inflammatory components. The safety of medical cannabis. So we're always afraid of overdosing, and you can see here that marijuana has an extremely low affinity for the brainstem, which is where your breathing apparatus begins. So there's a little girl in Edmonton that ate some gummies. I don't know why. Her dad just had gummies hanging around. But anyway, she overdosed on gummy bears that had marijuana in it. She went to the hospital, and she left the next day after being observed. She didn't die. She didn't die. Why? Because you still have a heart rate, you still have breathing, even if you overdose on cannabis. Heroin has the worst brainstem affinity. So when you take heroin, a lot of it goes to the brainstem, and guess what? You stop breathing. So overdosing on cannabis is extremely rare, and we probably have more people die every year of prescription medication death than marijuana deaths. 400 people die every single day in North America due to prescribed medications. Cannabis, very little. Why? Because it doesn't influence your breath and your heart rate. Addiction risk. Cannabis it's a drug. There is very little addiction risk. It does exist mostly in young people that consume too much. Don't forget that your brain is being formed until the age of 25. I don't prescribe medical cannabis, THC, in anyone less than 25. Your brain is still being formed. That's why a baby comes into this world so fat and round. It's because their brain is being formed. You get your subcutaneous fat, and you go into your brain, and you're forming brain connections and whatnot. Okay? A monkey comes into this world thin. Because their brain is already formed. They don't need to have some formation of their brain during their, okay, enough of the monkeys and stuff, but back to cannabis, cocaine, alcohol, heroin, and nicotine. Nicotine is the #1 gateway drug. Nicotine is pound per pound the most addictive substance that exists. Yeah, nicotine. I didn't say dangerous. This is addiction. Yeah. So limited serious adverse effects with cannabinoid-based medicines. 141 users of CBD-based medicines. 12.5% THC versus 215 controls with chronic pain for 1 year. No increase in serious events versus control. No difference in cognitive function, biochemistry, hematology. Non-serious adverse events increase in cannabis users after 1 year. There was a significant improvement in the levels of pain. Remember that. Symptom distress, mood, and quality of life. So this was 141 cannabis users versus 216 controls. THC adverse events, very common: dizziness, drowsiness, fatigue, dry mouth. I'm going to say dry mouth is the most frequent. Coughing and phlegm, especially if you smoke it, which I don't recommend. Anxiety, those are side effects if you don't balance out with the CBD. Cognitive effects, I did have an elderly gentleman that his Alzheimer's dementia worsened. I'm not sure if it's the THC or just his state. Euphoria, blurred vision, headache. Extremely rare, the cardiovascular events, orthostatic hypotension, paranoia, depression, ataxia, discoordination, tachycardia. Cannabis hyperemesis, we do see, each gastroenterologist probably sees 2 or 3 a year now. It's usually young people that consume a great deal and too much of it for a long time. And they do respond to capsaicin cream by stimulating the TPRV1 receptor. And the Emerge doc will give them Haldol, which breaks it right then and there. I don't recommend Haldol, but you can also put some capsaicin cream, which is a very spicy cream, on their belly, and it also works. Efficacy. So in this review of the evidence, National Academic of Sciences in Engineering and Medicine, there is conclusive or substantial evidence that cannabis or cannabinoids are effective for the treatment of chronic pain in adults. So really, pain is where medical cannabis works the best. That's why I started prescribing it for my patients: quality of life, pain control, and sleep. Review of the evidence. Health Canada, there is more consistent evidence of the efficacy of cannabinoids, smoked, vaporized cannabis, or other forms of THC, nabaxi, malls, prescribed THC in treatment of chronic pain of various etiologies, especially in cases where conventional treatments have been tried and failed. The Society for Neuropathic Pain, this is for chronic pain. You see that they suggest gabapentin, tricyclic antidepressants, which has a half-life of 36 hours, by the way. So you never really get rid of the drug, you just keep on accumulating it. Half-life means it takes 36 hours to get rid of half of the drug. I don't know if you noticed, but there's 24 hours in a day. So the dosage in your body just keeps on growing. SNRIs, those are antidepressants. So they suggest gabapentin, tricyclics, or antidepressants, tramadol, opioids, and then next cannabinoids. Most likely in the future, cannabinoids are going to go up above opioids or tramadol for pain control. Cannabinoids are effective for reducing neuropathic pain. This is for neuropathic, like pins and needles, either drug-induced, chemotherapy-induced, or if you have like pins and needles all day long. So tricyclic antidepressant, opioids, and these are the number needed to treat cannabinoids, 3.4. So 3.4 people need to be treated with medical cannabis in order to have one person relieved of their neuropathic pain. Number needed to treat. You saw that the Society for Chronic Pain suggested gabapentin first. 6 people need to be treated with gabapentin so that one person will benefit. The reason that cannabis is not higher up is just because we don't have a history with it. We're just starting to, it just legalized. Doctors have been able to prescribe it for such a short time. We don't have a lot of history. But you see that just by looking at the number needed to treat, the SSRIs and the gabapentin are actually much more difficult to treat. 7 people need to take it so that one person will benefit. Cannabinoids, 3.4 people need to take it so that one person will benefit. Cannabinoids may have opioid sparing effects. Heroin addicts that smoke pot consume less heroin because they're happier. They don't need as much heroin to change their state. Very famous study in the 1970s called Rat Park. There's a psychologist from BC that gave rats full, amusement park, and they could run, they could play, they could do what they wanted, and he gave them a choice of water or morphine, and they chose water. And then he put rats in a cage, in a bunch of cages. All they did all day was sit right there, and he gave them water and morphine, and guess what? They took the morphine until they died. So it's not the drug itself, it's the conditions that we're placing ourselves. Portugal had a drug problem in 1991 and legalized all forms of drugs. So they didn't victimize the drug users, right? They didn't make them evil. They tried to help people, understanding that it's the circumstances. Okay? If you have 20 bowel movements a day, you've got chronic pain, it's going to wear you down, for sure. It's the environment. So my thought process was, let's not victimize people, let's give them some quality of life. People that have chronic pain and take opioids take less opioids if they also consume cannabis. Efficacy. Cannabis can impact the brain-gut axis to alter gut function through actions of the enteric nervous system. The CB1, CB2 receptors, they work in the gut function, the immune system of the gut, the intestinal barrier strength. So through different actions, that's how the cannabis can impact the brain-gut axis through the enteric nervous system, altering pain transmission, possibly altering gut barrier function, also the immune, like I mentioned, and through the gut microbiota. People that smoke pot, even if they eat more, are thinner in general because it changes their gut bacteria. Pot smokers eat more refined carbohydrates, they snack more, but in general they're thinner because it changes their gut bacteria. Medical cannabis and GI. Cannabis and its derivative have been used in the treatment of GI motility, IBD, GI pain, disorders of reduced appetite, such as cancer and HIV, nausea, vomiting. Again, this National Academy of Sciences and Engineering, there is insufficient evidence to support or refute the conclusion that THC is an effective treatment for the symptoms of IBS, irritable bowel syndrome. At the University of Calgary, we have applied for a grant, a research grant to look at the specific IBS, irritable bowel syndrome, pain and diarrhea, and CBD oil and a touch of THC at night. So it's coming. There is no evidence to either say yes or no, so we want to answer that question. Canadian Association of Gastroenterology, my good friend, Chris Andrews, he was the lead author. Evidence that use of cannabis is associated with objective measures of reduced inflammation is largely lacking. So we're looking at inflammation here is lacking and limited to small studies with insufficient power to detect clinical relevance difference. Okay? Cannabis and cannabinoids may be helpful in GI symptoms to control especially short-term use of refractory nausea, vomiting, diarrhea, abdominal pain, where conventional therapies have failed. The European Pain Federation, cannabinoids-based medicines can be considered as an individual therapeutic trial if established treatments have failed and careful analyses with multidisciplinary assessment. You should have a talk with your doctor to see if this is right for you. Crohn's disease was statistically superior to placebo for pain relief, but not in the induction of remission, but this was a small trial. Low-dose oral cannabidiol was not statistically superior for placebo for pain relief. So CBD, in a very small study, has been not shown. So we don't know if CBD doesn't really work or if just the dosage was wrong. And my gut feeling, get it? No, my gut, no. My gut feeling is that the dosage was very, very small, and that's why we did not see any statistical significance. So this is the trial on Crohn's, randomized controlled trial, THC smoked, 8 weeks, placebo-controlled, only 21 patients. The primary outcome was the Crohn's disease activity index, did not induce complete remission, but there was a statistically, I can't speak today, I have a dry mouth, significant clinical response. I was up early at my daughter's hockey rink today, and I just I need coffee, and it's like, plus I've been on call for 3 weeks, so there you go, woe is me and all that. So IBD, clinical response, there was a drop in the CDAI in 10 patients versus 4 patients in the placebo group, and this was statistically significant. No change in CRP. There was, though, reduced pain, better appetite, better sleep. So again, quality of life indicators, pain, sleep, and appetite. No significant side effects, no lasting clinical improvement, though, but there was no endoscopic assessment. Cochrane is the way that, a bunch of very savant doctors get together and decide whether Joan and I are going to move forward on a certain treatment recommendation. The effects of cannabis and cannabis oil on Crohn's disease and UC are uncertain, thus no firm conclusion regarding efficacy and safety of cannabis and cannabis oil in adults with active CD or UC can be drawn. IBD, there was a nationwide study in the United States using diagnostic codes from 2002 to 2014, 3.3 million patients with IBD, 1% had cannabis use disorder or consumed too much. Cannabis users increased from 0.3 to almost 2% over time. Mortality was actually less in cannabis users. Colectomy, removing your colon, was less in users. Blood transfusions actually less. I have no idea why. Cannabis users required less blood transfusions. Hospital stay was the same for whether you smoke cannabis or not. So you actually died less if you smoked cannabis in this nationwide study. CBD and IBD, 19 patients, 11 were men. Oral CBD oil, 20 milligrams per day. This was the dosage that I was saying that was non-significant. Likely 20 milligrams per day is not enough. In our IBS study, we're going to look at 20 milligrams twice a day. So you see that we're not really sure. We don't have a lot of studies. Cannabis was a scheduled substance right along cocaine and heroin for the longest time. So we didn't really study. We didn't really have an opportunity to look at it. I mean, for the longest time, you could drive to the liquor depot, go outside and drink yourself to death in the parking lot, but if you had 1 gram of marijuana on you, you'd go to jail. I don't really understand this world sometimes. I mean, 5 major banks admitted to fixing the price of silver, paid $650 million fine, and no one goes to jail. But if you leave this building with 10 grams of marijuana, you're going to go to jail. There is currently no evidence to support the use of CBD in the treatment of IBD. In low dose, it does appear to be not harmful in IBD patients. In higher dose, acutely, in healthy controls, it may reduce intestinal permeability. That's extremely high dose. This is the study looking at intestinal permeability. Oral CBD, 600 milligrams. You remember that study that was non-powerful enough 20 milligrams, this is 600 milligrams. That showed a decrease in intestinal permeability, but 600 would be extremely expensive. GI motility, there is currently no evidence to demonstrate any benefit of cannabis in IBS or other GI sensory motor disorders. Recreational cannabis and bowel function, this was a national health study again. Almost 10,000 respondents, cannabis users was 12%. Constipation, patients were non-cannabis users were actually more constipated than patients that use cannabis. Diarrhea was the same in both groups. There was a 30% reduction in constipation adjusted for age, sex, BMI, education, socioeconomic status, tobacco use, alcohol, and other factors. So it seemed to help constipation. Dosing and administration. Medical cannabis is contraindicated. Remember that the brain is being formed until the age of 25. So no THC. If you consume too much THC too young, for too long, you start having language disorders and you start having, less desire to move forward. Breastfeeding, history of cannabis, hyperemesis, history of cannabis use disorder, psychiatric unable mood disorder. If you have any psychiatric illness like schizophrenia or psychosis, you should not use cannabis. Untreated substance use disorders, you're addicted to opioids, but we've seen that patients that are on opioids consume less opioids if they do take cannabis, but if they have another substance abuse disorder, we don't want to put another abuse disorder, so that's why we screen it and we don't usually recommend it. We recommend you being sober for 6 months before we start it. Thank you for the water. Relative contraindication in the use of central nervous depressants. Having said that, gabapentin is a central nervous system disorder, depressant, and we use it all the time for neuropathic chronic pain, so this is relative. Cannabis use disorder, just like any other disorder, you're asking for more and more drug. Most of the patients asking for medical cannabis aren't looking to get high, aren't looking to escape reality. They're looking for resolution of their quality of life. They want to sleep a little bit better. So they're not asking for more and more and more and more. 1 gram is, correct me if I'm wrong, about 2.5 joints. Most patients don't even take a joint. They take half a joint in equivalent. I suggest oils. You can vaporize it as well. But I suggest oils or other forms of absorption. So if you're asking for more and more, your social network is saying that, hey man, you're consuming way too much here. This is costing a fortune. Difficulty reducing the use. You've got anxiety. You've got problems when you withdraw. You can't perform at work. You can't perform at school. You've got poor social functioning. Then you've got a disorder. You're consuming too much. Alcohol. Other forms of medications. So that is a problem, and that's something that we screen for when we prescribe it. Driving, 4 hours after inhaling it, 6 hours after consuming the oil, you should not, within those 6 hours, you should not drive. I tell that to patients. So you take your cannabis THC at night at 10 o'clock, and then you drive the next day at 7 or something like that. If you have at least 6 hours, then you should be okay to drive. If you don't feel like you should drive, like you still feel dizzy and you're just starting out, you probably took too much, so then you should just call an Uber. It's not safe. Just like you're going to a party and you should pace yourself depending on your BMI at about 1 drink per hour. If you're on call at the hospital, you don't drink at all. So we all live with these. We all, take precautions when we drive or when we're responsible for other people's lives. Travel advisory. I wouldn't recommend traveling with it. You can leave the Canadian border with your prescription. You can travel anywhere in Canada with your medical cannabis prescription. I wouldn't recommend going to the United States. It usually depends on the hosting country, but it's a pain in the butt, so I wouldn't do it. I wouldn't travel. I don't recommend it, but you can travel within Canada with your medical cannabis prescription. If I have a patient on medical cannabis and then they go to the United States, they don't bring it with them, And sometimes they go to states that are legal, like in Arizona or Nevada, and then they purchase it down there. How does it work? You go see your practitioner. Either your practitioner is comfortable prescribing medical cannabis, or you go to a medical cannabis clinic, Harvest Medical, 420 Clinic in Inglewood. So these people are medical cannabis clinics, or your doctor. Your doctor will then authorize a medical document saying this patient has chronic neuropathic pain, this patient has chronic pain due to Crohn disease, they've got difficulty sleeping. They prescribe a medical document with an amount, so 1 gram per day, up to 1 gram per day. That medical document is then sent to a licensed producer, Spectrum Cannabis, Aurora, Broken Coast. These are companies that are approved by the government to produce medical cannabis for your benefit. You then register with this company, 1 prescription, 1 licensed producer. Okay? You can't take your prescription or your medical document and go to five producers. You go to 1 producer with 1 prescription. So we usually give 2 prescriptions so that they can register with 2 companies. Because marijuana is cyclical, sometimes the product can go down, so then you have the option to go somewhere else. Once you're registered, the licensed producer will then send the product to your house. That's how it works. Practitioner, medical document, registering with the licensed producing company, and then the licensed producer will send the product to your house. Thank you.